My name is Cezane Karki, and I am a software developer in a US healthcare company, TechKraft Inc. So my job is to work around everything what happens in the company, like from bug tickets to the development of AI models and everything, right? So today I'm going to speak about the exciting development and the promising development of integration of AI in healthcare. So anyone who is here from the field of healthcare?
Works at healthcare?
No, I mean to say in the healthcare data, anything. So, yeah, from which company?
What is doing? It's a startup, US-based startup.
Okay. Yeah, let's start now. So AI in healthcare. So healthcare has been ever evolving field in the technology as well. So it has been evolving from the in the traditional methods. It would be like you go to the hospital, and if you have to do any of the testings and any of the things like MRI, CT scans, then we will use to wait for the doctor for the result, right? What doctor is going to say and what's going to happen in our body. So in that case, now we do have the medical imaging systems and all of those things that looks on the CT scans, X-rays, and MRIs to find out whether there is a brain tumor or there is fractures anywhere in the body or like pneumonia in the lungs. So that technology has helped in bringing the proper outcomes to the patient and enhance the efficiency in the field of healthcare, and also has brought into the reduced costs with the development of technology. So while doing the development of technology, there's gonna be lots of cost, right? So after the integration of the technology, the manpower and resources, the resource allocation are going to be saved. So that's why it's gonna have a reduced cost after their proper development. And now the AI has been a game changer in the field of healthcare. So what is AI? Can anyone say? Like in simple terms, what is AI?
An expert system maybe?
That's also correct. So in simple terms, if we say about what is AI, then it's like the simulation of human intelligence that is processed by the machine. That can be a computer or any of the IoT devices that you have, or that will be a smart wearable watch or anything. So AI can be integrated in wearable watches, tablets, mobile phones, everything, right? So if you see any of the camera, I think most of you might have iPhone and Samsung, right? So in those cameras, you see having a small sensor of camera, you are getting a quality image from that, a deep, with the proper pixels and everything. That's due to AI, actually. So AI in the healthcare field has evolved a lot. So in the field of healthcare, AI encompasses the technologies like machine learning, natural language processing, robotics, predictive analysis, and many more of the technology that's being integrated in the current scenario. So the importance of the AI in healthcare cannot be overstated. It has brought a lot of revolution in the place of healthcare, starting from the medical imaging to the early digit diagnosis and personalized medicine and clinical support, and not only in the tasks of the clinical things, but also in tasks of administrative things, like parsing the data from EHRs, and then the EHRs data that we get from the healthcare insurance companies. So the EHR means the electronic health record. So electronic health record has the data in form of logs. So each of the kind of data, like insurance data or the health data, are different in that case. So AI has been helping in parsing the data from those kind of logs. So going on further, AI applications. So अब हामी अघि medical imaging को कुरा गर्दाखेरि we used to go to hospital, and then it was like doctors will see every of the results and will predict this has happened to you, right? So in every case, can we trust the doctors? So like if you are doing a regular visit to a single doctor, then you're gonna trust him, right? So if you go to hospital and if any of the doctor says like you have to do operation in this thing, then obviously everyone is going to take for the second opinion rather than doing the operation directly, right? So that's also the trust issues actually. So because the system and the technology in Nepal for diagnosing everything is not properly implemented, right? But if you see in US and other developed country, then we can see the medical imaging and personalized medicine support, clinical decision support, healthcare operations and administrative, remote patient monitoring and healthcare robotics. So अब हामी हस्पिटल गइसकेपछि त अब लाइक टेस्टहरु गर्यो, ल्याब टेस्टहरु गरिसकेपछि AI model can automatically say like from blood report these are the things that has happened to you. तर blood report मात्र त्यतिले मात्र पुग्दैन होला नि हैन. So we do have the historical data of patients, each and every data. So looking on the historical data and the present data of the blood reports and everything, the AI algorithm is going to analyze and say, this has happened to you, and that's not only the thing that we gonna trust on. After the validation of the AI, the clinicians should also validate, because AI is a technology and we can't fully trust on the technology in the developing era, right? And remote patient monitoring. So everyone, like most of you might have been wearing the smartwatches and those sort of things, right? So recently in a news, it has been said like the most of the AI technologies has been integrated in the smartwatches itself. So the technology is like the data has been trained for getting the insights of the proper insights of the users. Like म अब स्मार्टवाच युज गरिरहेको छ, मेरो चाहिँ अब हेल्थ like heartbeat, blood pressure, sugar pressure, everything, sugar level, everything अब स्मार्टवाच ले लिइरहेछ भने, so from that AI can get the insights like this might happen or this is the thing that's going to happen to you. So that insights are sent to the doctors, like your physicians. So these are the things that are being integrated in the current scenario in the developing country. So like developed country for like providing a proper healthcare solution for the people and proper outcomes for the patient. So healthcare robotics मा चाहिँ के पर्न सक्ला, कसैलाई के आइडिया छ?
Precision surgery.
Yeah. So healthcare robotics भनेको चाहिँ like it's just a thing that has been developed recently. So it has been researched since long years of times, but यो चाहिँ भर्खर डेभलपमेन्टमा आएको छ. And like भर्खर पनि अब यसको युजहरु हुन थालिसकेको छ हैन. So have you ever heard about the robotic surgery, anyone?
Wants to do with that.
Sorry?
Neuralink also wants to do with the same domain.
Yeah. So robotic surgery, anyone has heard, like it might not be the integration of AI or anything in this. The surgery that has been done with the robotic automations. Anyone has heard about that? So who said yes? Could you please say where have you heard? And yeah, please.
It could be done by using the motors, controlling the motors.
Yeah.
While doing the surgery for the precision of the surgery.
Yeah, so the term robotic surgery, like we might assume that we are going to see a robot doing the surgery, right? But that's not the case. If we see over here, then there is the machine and the doctor is controlling the machine sitting in a chair. So this is how the robotic surgery has been implemented in the current scenario. So the robotic surgery, it was done in our neighboring country, India, in Savai Mansingh Hospital, Jaipur. That was the first ever surgery done, robotic surgery done in India for removing the gallbladder cancer from the human. So, in a case study done by the University College London and University of Sheffield, it has been proved that robotic surgery are more safer and like it takes less time to recover for the patient. So in the clinical trials, what they have done is like they used the robotic surgery for removing the gallbladder cancer. So in that case, what they have found that the patient were recovering 20% faster, and they needed to stay like 20% less in the hospitals. And why was it? Was because while doing the robotic surgery, there was precision, and due to which there was less blood loss, and the wounds were also small. So due to that reason, the robotic surgery was found safer, and like the recovery time was less. So in that case, like it has been providing a proper outcome to the patient, right? And it has been like reducing the cost for the patient as well to stay in the hospital or anything. So if we have done the traditional method of surgery, then it will be like there will be a large wound and going like staying in the hospital for 10 to 15 days, and that will be a hectic thing for the patient as well. So actually that wasn't a good outcome for the patient until the robotic surgery was invented. So after the invention of robotic surgery, it has been used in the many places of the world, and it's trying to be used in the developing country as well. So if you have heard about the laparoscopy in Nepal, yeah, that's also done with the motors and each of the things, right? So the handheld, the doctors uses the like robots, like machines from the hand, not in this automatic way that was shown in the previous picture. In that way, but doctor used to do directly using the machines with the hand directly. But now in this case, it's like they are staying in a chair and they are doing everything by a single click and moving the like kind of things that we have in joystick for moving the players, right? So they use those things. And benefits of AI in healthcare. So AI in healthcare has helped in the improved diagnostic and accuracy and speed. In that case, it again comes under the medical imaging that we have talked previously. So in that case also, next thing is like when we get a disease diagnosed faster, then we're gonna have a proper treatment in the early state, right? So like what if we get the diagnosis of cancer at the third stage? It will be difficult for us to be cured. That's a difficult task, but with the help of AI in healthcare, the cancers and each of the things are being diagnosed in the early stage. So not each of the cancers, but there are ongoing research and development for doing these things for the many of the diseases. But diseases like brain tumor and pneumonia and some of the cancers like I think blood cancers as well, and the cancers in gallbladder, they have been identified by the AI. So next thing is like personalized treatment plans. So and the clinical support for the physicians in the hospital. So what it's like is like we do have many of the apps like Thermos and Google DeepMind Health, and then IBM Watson Health. So these of the technologies are helping the doctor in providing the personalized treatment plan and medicines. Like what medicines can be prescribed to the patients, right? So those things are being validated by the doctors itself, and like it's helping the doctors for the decision also. So in many cases they have been passed, and in many cases they have been failing. But in terms of validation, it's like there is a double validation, and like the doctor and the patients both can be ensured that this is in a correct way, right? So and the next thing is like operational efficiency and cost saving and resource optimization. So in case of operation efficiency, if we go in a hospital, then a big hospital, then there a good one and a big hospital, then there might be the pack of each of the bed might be packed, and there won't be any of the resource available, right? So using the predictive analysis in AI, the hospitals can read the historical data and the data of the patients currently, like the patients that have been coming to hospital doing the real-time streaming to read the data, for getting the insights like whether the patients need to be admitted in the hospital or they might not need to be admitted in the hospital. So if we get the hospital resources get those information, then it's gonna be easy for hospitals to like and provide the beds and everything to like work on the resource management and provide the beds, right? And the next thing is like the administrative tasks, like reading the data from EHRs. Currently, like reading the data from EHRs are automated, but in a low level of automation. So proper reading data from EHRs hasn't been implemented till now. So in that case, AI can help in the parsing the data from EHRs, and also for like and in the tasks of billing also. So they can analyze what's going on for the person, and they can directly see like what billing should be done. And that reduces the manual work and the manual error that can be occurred by the manual intervention of the human, right? So those saves the cost and the operational efficiency of the hospital as well. And it's going to be availability for the resource is going to be for the patient as well. So like patients can get a good service if the resources are available, right? So if everyone is busy in hospital, then no one is going to get the good services. Like it's like a person can get a good services, another one like they might not get the good services. So in that case, the AI has been helping and transforming the benefits. So implementing AI in healthcare is not easy as we think. So what do you think, what might be the challenges in this thing?
It's a very new technology that like really no structure has been made to implement it. There's no formula. So people might be skeptical about putting different technology into conditions where people are facing life-threatening diseases.
Yeah. So any other things?
A lot of clear data.
That's the main point. And then?
Trust issues from patients.
That's also the thing. Anyone else? Actually, that's the point that I wanted to hear from my side. Because the healthcare data is too sensitive to be used in training the AI models, right? So have you heard about the data loss, data leak of Microsoft recently? The 33 terabytes of data has been leaked from Microsoft while doing the training of the model. So they have integrated their own token in the while training it. So that's why they have lost the data of their own chats, the emails, and everything within the company to the outside world, right? So that kind of issue, if that kind of issue occurs in the healthcare, then that's gonna be a very challenging task, right? So let's look on the regulatory and legal challenges. So regulatory and legal challenges includes the HIPAA policy, high trust, and GDPR. So these are all the policies that are made by the governments and the organization for protecting their data. So anyone working on the US healthcare or the Australian healthcare or the European healthcare might know about these things, right? So in these things, what their thinking is like, the data that has been in the US should be in US. It should not go out of the US. So the data should not leave the land of like soil from their country. So it's like, when we try to work on the data of US healthcare, we won't get data directly into our computer. We will be working on the virtual machine that's deployed in their own server in US. So this is the way that we work in the data of the healthcare. And we won't be able to use our normal mobiles in the rooms that we are working with the data. So we need to have a mobile which doesn't consist of camera or anything that captures the data. And any of the specific chips cannot be taken into the room for working on those kind of data. Right? So we call it a green room or a clean room in Nepal. So that if that is not maintained, then clients will say like, we won't be working with you because the data are very sensitive. So the informed consent to use. Anyone who reads the agreement term while installing the software? No one, right? Like we install the games, we directly like click on the checkbox saying like I accept the terms and conditions and do next and install, right? But what's going on the back end on the agreement? No one knows, right? So this is the same concern with the healthcare also. Like While doing the training of the models for medical imaging, diagnostics, and surgery, robotic surgery, that requires a very sensitive information for the training, right? So where the information comes from? They comes from the patient itself, that are given by the healthcare providers. So are healthcare providers taking the consent from the users? I think they are not taking a proper consent till now, because previously what it used to be like, they will ask the users to like, can I use your data in this thing? And users will say, okay, then sign in a paper, right? But with the evolution of technology, it's been like the agreement form is directly being sent into email or any of the things, like through the applications or any of the things. And who would like to read that long terms and conditions? No one. It will take around 15 to 20 minutes to read all of those things. That's going to be a hectic part for the daily users of the application, right? So in that case, it's like no one is reading the proper agreements, terms and agreements of the software, and they are being like full, actually. Because it has been written like the data can be used for these things and these things. Everything's written over there, but no one reads. So that's the most challenging part for the informed consent to use, because no one reads it. And the next thing is like, for the informed consent to use also, the patient must be informed about where the data is going to be used and why the data is going to be used. That's an ethical consideration over here. So if the patient is like said like your data is being used in this field for this reason, then it's fine. But in terms of AI in healthcare, there is a term named black box AI. Do anyone knows about the black box AI? Yeah, could you please say what that means?
We can't know how they came to that decision.
Yeah, so that's the thing. We give input data sets. There is like many of the trainings and tasks are going inside the codes, and there is an output. And there is a debate in the black box AI also. So some of the people says like there should be transparency, how it's working on, and some of the people says like transparency is not required, the outcome is the main thing. Like we go to the doctor and doctor gives us the medicines, like saying this had happened to you. But why the medicine is given to us, what are the components of medicine, do we ask that? Never, right? So that's the things that's the same thing in the black box AI. So we are getting the outcome, but we don't know what's going inside. Even the developers and the developers don't know, because if we see a deep neural network of millions of hyperparameters, then how can a developer know that this thing is happening in the AI model? That's a difficult part, right? So the concept of black box AI should be removed in this case. So it's like there is a debate on should there be the proper implementation of AI with knowing everything by the developer, or the black box AI should be continue on running. So that's a debate since 3 to 4 years for now. And then another thing is like, when we use chatbots or anything, our data is being constantly used by the real-time training model. So if we use ChatGPT says like, your data is not going to be trained in our model at the beginning. But it's like, they use the historical saved data for training the model. They don't use the real-time training. We found out that while doing the security checks in the ChatGPT, because health data is very precious. So ChatGPT should not get the data by themselves as well. So that's the thing. So informed consent to use is the one of the challenging part for training the healthcare AI models. Next thing is safety and transparency. So how many of you know about the IBM Watson Health? No, right? So IBM Watson Health is about giving the predictions, reading the historical data. It's just like a chatbot as well for the clinical supports and the medical, like it helps in drug discovery and development. It gives the insights like this can be done and all of the things, right? But while doing a gallbladder IBM Watson Health was used for the clinical support. In that time, the IBM Watson Health gave a wrong recommendation to the clinicians and to the patient as well. So that's the issue of the safety. How can we easily trust the AI? So how can this safety issue be solved? Is like that can be solved by doing the validations from AI, and the same validations should be done from the clinicians itself. So both of the things should be matched for doing the safety things. So how long should we do it for? Because anytime the technology might fail, it's not like every time it's gonna give the true output, right? So in that case, safety is the main concern. Like if we are training the model and it's deployed, and we ask the model, like physicians ask for the recommendations, then model gives the recommendation, right? So after the model giving the recommendation, there should be clinical trials on that recommendation as well, the validation on that recommendation. So that's the thing. And next thing is about the maintaining the transparency of AI functionalities. Again comes about the black box AI over here. So there is no transparency like how black box AI is working and what's going on in the back end. Like users are going in the hospital, clinicians are in the hospitals, clinicians just says, I need this thing, and the clinicians get the support from the AI, but how is that working? Do clinicians know how is that working? Or do the patients know how is that working? So there should be transparency about the working methodology of the AI. There should not be the whole concept, like how it is built or anything. But there should be a guide, like this works in this way. So we can trust this thing. So due to this, there is a trust issues on the clinicians and on the patients for the technology, right? And there should be a third party as well for doing the auditing of these things. So there should be the involvement of cybersecurity for checking like if the data is being leaked from the AI models or not. Everything should be there. And here comes the algorithmic fairness and biases. So what this can be? So in this case, it's like we are going to train the data for a specific region of US only. Then when training the data for the specific region of US, we're gonna get the historical data of patients and everything, right? But what does the data includes? The ethnicity, the race, age, gender, disability. Those are the things that matter, that should not be included in the training data set, because that brings the biasness. So if we like do the training on the people of US and if we try to use that in the Africa, then will it give the proper output? No, right? Because the ethnicity, race, and everything, religion, everything is gonna change over there. So it's not gonna be the same. So it will be difficult for AI to predict what's happening and what output should I give. So that's the thing. And next thing is like it will provide the false diagnosis and ineffective treatments. So on that part, what can be done to improve this thing? So there should be appropriate machine learning technologies and the hyperparameter tunings for the data set we provide. The data set should be of quality data set and adequate data set for training the deep learning models or the machine learning models. If we provide a small data sets and reiterate the training on those data sets only, then we are not going to get the proper output in the case of healthcare, because there will be lots of age-cutting cases in the case of healthcare, right? So that should be looked into. Another thing is data privacy. So NHS is National Health Services of UK. NHS and Google DeepMind, we're working together to find the acute kidney injury, like around 5 to 7 years. So during that period, the data of the users were being used without the informed consent to the users, right? So in that case, like they have been, like there was no adequate consent highlighted to the people, like the patient, it's going to be used in this way, the data is going to be used for the AI model training and everything. So starting from that time, there has been a data concern for the users as well. The trust, how the data is being used or how the data is being stored, how safe are the mine data are safe with the government. So in case of Nepal, we don't have the safety of data at all, because the government websites are being hacked easily. The website of TU are being hacked easily, right? So we don't have the privacy at all in Nepal. But in US, it's in US and European Union, there is lots of privacy in terms of data, like in terms of mainly healthcare, because there are lots of sensitive information like lab reports, biometrics, and the lifestyle of people, how the people are living, right? Every data is over there, because like it's gonna be helpful for the training of the model, because like how the people, how is the lifestyle of the people determines for the outcome of the patient, right? So it's gonna be like, is the people smoking daily, or consumption of alcohol is daily or not? Though all of these things matters for the training of the model. And the next thing is like, there should be anti-discrimination laws needed for these things. So for the data privacy, because if the data privacy if the data is leaked for any of the races, and any of the races data are keeping more securely, that doesn't work, right? So because previously there was the leak of the data in the European Union from the NHS itself. So there was a cyber attack I think it was a ransomware attack, due to which the data of the specific ethnicity has only been locked out by the ransomware. So that should, those laws should be implemented over there. And the next thing is like, if we are giving our data for the training, we should have the authority to rights to take the data back. Like I can say like, I don't want my data to give to you for the training. So in that case, these are all the challenges for the AI to be trained, right? So next things come over here is cybersecurity. So now we are using variables and everything, right? So is it sure that the variables are safe for us? Like the data of variables are safe? No, right? The people can directly attack into our variables and get the data from there. The daily data that is being recorded for the training of the model and everything, right? So those data can be leaked from the variables. And the healthcare administration system, with the evolvement of the technology, each and every systems are getting bigger, and the storage system are getting bigger, but there should be the implementation of cybersecurity as well for the security of each and every data that we use. So in that, there is also written that WannaCry ransomware severely distributed NHS, the National Health Service of UK. So there was a ransomware attack of WannaCry that due to which most of the data were lost from their systems. And for retaining that, it was difficult for them to get the data back. So these are the things that should be implemented for the training of the AI model. And sensitive nature of data. So we have a PHI and PII data. That's the most sensitive data, which shouldn't be leaked. So if those data are leaked, then identity theft and fraud can be done easily. So PHI data is used for the insurance things, and the PII data is used for the personal identification information. Health and medical records, mental health condition, genetic information, insurance and billing information. So the leakage of insurance and billing information will be a dangerous thing, because that might bring a blunder in the insurance system of the whole country, the leakage of insurance data. So that's too critical data for us, because in Nepal, how it's going is like, we do the treatment in the hospitals, we take the OPD books and the bills with us and go to the insurance company and show it, right? And we get the refund, like it might be 80% or 90%. But in terms of US or Europe or Australia, it's like everything is inserted into the system, and the EHR are sent to the insurance company directly. So this is where EHR comes into. It's for the communication of data from one place to another. And then clinical data trials and laboratory test results and lifestyle information. So these are all the sensitive nature of data that shouldn't be leaked while doing the model training of the AI. So we have consequences of leakage of sensitive information, and the identity theft and financial fraud, the fraud in the insurances, and there is the policy that says if there is the leakage of the confidential data, then you are going to be jailed and going to be fined a hefty amount. That might be $500,000, $1 million, no limit for that, because it's going to check how much data has been leaked from there. And ethical considerations in the AI-powered decision making. So the things that I talked from the starting about the challenges, all of the things are the considerations that should be looked on for creating the AI models. So it's like bias and fairness. The algorithm should not be biased. Transparency in the algorithm. Clinical validation and safety. Privacy and data protection. Patient consent and autonomy. Accountability and responsibility. Who will be accountable and responsible if something happens from the AI decision to the patient? So that should also be the ethical considerations. So integrating the AI with the existing healthcare system, that's gonna be a difficult, most challenging task over here, because we don't know how the system are being managed properly. First thing. The second thing, what is the quality of data that we have in the system? The third thing, do we have the adequate data for the integration or not? Right, and then it comes about the ethical things and regulatory things, compliances, like will the HIPAA policy or the GDPR policy, how the high trust or these all of the policies gives us the authority to integrate the data with our AI model or not. So all of this should be checked, and then there will be the workflow disruption also, because at the moment the workflow is different in the healthcare companies, but after the integration of AI, the workflow will be changed as well. So that's going to be a next difficult part for us. And these are the case studies and success studies like DROM that is used for getting the diseases that we occurs in the skin or the skin cancers, any of the things related to skin. And IBM Watson Health, it's used for diagnosing the diseases and treating patients. Not only that, it is also used for the clinical support decisions as well. And Google DeepMind and IBM Watson Health does the same thing. And Babylon Health is AI-driven chatbot for medical consultations. So this is not used by the end users, but this is used by the clinicians. All of these technologies. And the Tempus as well. So we are going to see a short video of Tempus, how it works.
Samantha Johnson's report.
Please select from the following complete reports found for Samantha Johnson.
Can you confirm her probable BRCA2 germline mutation?
So future trends and so that was a demo of how Tempus One is being used in the current scenario. So Tempus One is integrated with a single healthcare provider only. It's not for all of centrally data based. So it's gonna be for a single healthcare provider only for their own patients. So the data is trained with all over the country, but it's going to work for the single healthcare according to their patients' data. right? So the future trends and possibilities. So there are lots of possibilities that can be implemented in the AI in healthcare. So like the first thing is like removing all of the challenges that occurs during the training model of the AI. That's going to be the first possibility, and the other things are like virtual health assistants and remote monitoring, remote patient monitoring in an advanced level, and accelerated drug discovery. In the current scenario, drug discovery is being done efficiently than the clinical laboratory trials, but that's also a slow process. So accelerated drug discovery is going to accelerate everything that's happening right now. And other things are like the main thing is like the regulatory framework. So after the implementation of the proper regulatory framework, everything is going to be in a stable thing, and it's going to be easy for the developers to train the AI models in healthcare. So that's it from my side. And do you have any of the questions regarding these things? Yes, please.
You talked about picking a data from certain part of the world, and you said that there will be historical data and biases and the ethnicity of all the things. That if ethnicity is a biasness factor, then and if we remove ethnicity from a AI model, then how can we say that the AI model that is trained on American data will be viable for Nepalese people, or the data that is trained on Nepalese people will be viable for African people?
So it's like the data for the American people will not be valuable for the Nepalese people, right? Because in America itself there are lots of ethnicity and races, right? So for the specific country also, the ethnicity and races should not be used for the proper outcome to the patients. So that's the thing. So it should not be targeting the minor group only. So it should be targeting the whole country. So for that, if we see in Nepal also, we do have different ethnicity of people, right? So in that case, can we integrate the ethnicity over here in the training data set? No, right? So that's the point actually. Rather than doing, because the environment of Africa and US doesn't matters. Right. So in Africa, there is like different parts of Africa in the disease-borne area, right? So many of the diseases are there. So in case of US, there might not be those kinds of diseases. So in that case, the data of US won't be working in Africa. So there should be the model training using the data of Africa itself. So there should be targeted users rather than overall users of the world.